What's up everybody, Dr. Rossi, welcome back to the channel. Now I haven't cut longer handed material in a while, but I'm going to cover a topic that I'm actually covering for our residents this week in lecture. And it's a very important one. What we're going to be talking about here is how effective, or what is the efficacy of antidepressant treatment. And I'm going to try to put this issue to rest because it's been the topic of discussion all across psychiatry. There's a recent publication in Psychiatric Times that talks a great deal about how STAR-D really didn't represent the data correctly and that there's probably less efficacy for antidepressants than we even previously thought. So we're going to cover all of that in a series of videos starting with this one. Now this one's really important because to understand the answer to this question, we must first understand how efficacy data is presented and what gets published in medical journals, right? So what we're talking about here is that most of the data that gets published is overwhelmingly positive, right? Very few, if any, negative trials are published. And in 2008, Turner and colleagues brought this to our attention in the New England Journal of Medicine. So probably one of the most prestigious journals in the country. We're talking about a problem that Turner and his colleagues identified. So what they discovered was the FDA database had an even split. It was approximately 50-50. 50% of the studies published on antidepressant treatment were negative, meaning they don't work or weren't very effective, and 50% were positive. So this is interesting because when you actually look at what is published in the medical journals, right, what is available on, say, PubMed, for example, 90% were positive and only a very small percentage of negative studies made it to publication. Somewhere less than 10% made it to publication. Now, the problem with this is that as clinicians, we are basing our treatment decisions off of the published data, and we're getting a very biased view of antidepressant efficacy, right? Pharmaceutical companies have very little incentive to disclose negative trials. It would only hurt the drug that they're trying to market. So why would they present this data at all? We now have a law, though, that mandates disclosure of failed trials on clinicaltrials.gov. So you could go to clinicaltrials.gov and you can find this information on the website. But many clinicians are not taking the time to look at all the data and are still basing treatment decisions largely off of published data, which remains overwhelmingly positive. And what we're going to do in the next video is we're going to discuss the true efficacy of antidepressants and what constitutes a clinically meaningful improvement in depressive symptoms. So stay tuned for the next video in this series. Thanks for watching. If you made it through the video and you haven't subscribed to the channel, please do so. It really helps me to keep making these videos, knowing they're valuable to you.